We're digging deeper into a study we told you about last night. A study found it's not feasible for the University of Maine to open a public medical school. News Center Maine's Akua DeVal shows us why campus officials say they still want to make the med school a reality.
So what I take from the report is that we have a big challenge ahead of us.
That report stating that limited funding and too few residency positions are blocking the University of Maine from establishing its first public medical school.
Having a public medical school that's located sort of mid-state would enable stronger reach to the very rural areas across the entire state. And that would be key for us.
A new independent study from medical education consulting firm Trip Umbach finds that despite UMaine being positioned to lead a public medical school, it is not feasible at this time, despite Maine's growing doctor shortage.
We would have a tremendous opportunity to build from scratch a new vision for a medical school that really brings knowledge and technology to the help of the people.
If we don't do something in Maine, we're going to have more of a crisis in terms of healthcare availability than we already do.
Dr. James Jarvis with Northern Light Health says training doctors locally can help keep them in Maine for the long run.
We know is if we train somebody in a rural area, they actually find out about the joy of practicing rural medicine, what it's like to take care of that particular population, what it's like to have a slower pace in life.
Now UMaine is working to lay the groundwork to eventually establish a public medical school.
What can we do now to start to put in place all that we would need to build enough residency slots, to build enough clinical practice slots, to build good partnerships across the state and beyond, to be positioned to revisit this topic in 3 or 4 years.
Hopeful one day doctors can train and stay in the Pine Tree State. In Orono, Akua DeVal, News Center, Maine.